morning on this very nice, not hot morning in LA. I'm Christina Galley. I'm the director of the Department of Health Services, and it is my great privilege to welcome you here this morning and to introduce our esteemed Supervisor Hilda Solis of the 1st District. She has been such a force for bringing services into homelessness encampments, into Skid Row, leading work on the Skid Row action plan, and has made it one of the tenets of her role in being the supervisor of the 1st District and for the county overall to address the issues of homelessness that were faced in Los Angeles County. And I admire her leadership on this so much. I admire the way she pushes my department and other departments to do work on the ground, bring services to patients. There's not a time that goes by that any of us will speak with her that she isn't asking those important questions about what next, how to bring more services, how are we going to bring more and more services to the people that need them most, with always an eye on the most vulnerable, the people that are most in need, those who are most struggling and least able to take advantages of what the city has to offer. So thank you, Supervisor Solis, for being here, and please welcome.
Dr. Galley is really, our savior. I want to say that because I don't do this alone. This really is a teamwork effort, and I want to thank all of her staff for being here and for her team, herself, and her leadership, because I don't do it alone. I can complain and say, come on, we've got to get out there, boots on the ground right now, but it takes time, but it takes more than that. It takes also commitment, and I've seen it on the past few years that we've been addressing the pandemic, but more importantly, even now. And so I want to say thank you to all the staff. Give yourselves a round of applause, everybody. Please. I'm so happy about this. I'm so excited. I get to come when it's already being done. It's already being carried out. And I just want to thank our Department of Health Services, and again, Dr. Galley, for your leadership, because this woman has so much work to do. And yet she has time to come out here with us, to be with us here. And that's exceptional, because not every department head does that, and we have 36. So she deserves a big round of applause, please, please. And today is a dream come true for me, because I've heard time and time again how people have talked about how we need to have street medicine now, not yesterday, but now. So today we're happy to launch our LA County Street Medicine Program. Yes! We are here and we're moving forward. And again, I want to thank everybody, the Department of Health Services, Housing for Health Division in particular, for making this a county-wide program. It's not just a pilot anymore. It is a county-wide program. And that's thanks to Dr. Galley for bringing this vision to fruition for so many of us here today. And I especially also want to give a big shout out to the Department of Mental Health, because that's the other element that we know has been out here, but now we're all in one hand, right? Like I got 5 fingers, now we're all one body, and we're going to do it. And I'm so happy that we're here on Skid Row. This is where the largest concentration of unsheltered people live. We know that nationally. And it's something that it's a challenge, but I also take pride in the fact that our county is going to be doing some great things here. And I have to tell you that just starting this last January, they redistricted our seats. So I used to represent a portion of Skid Row. Now I represent all of it, okay? I represent all of it. And for me, people might say, oh gosh, Hilda, and grasp. No, I'm saying it's okay. We're going to do this. And we have superb services throughout the county and the city in partnership to bring these resources here to the people that need them the most right here. And I am excited that we even have a Skid Row action plan that we are putting forward. And I bet a lot has been going on. I know it for many decades. But finally, we're wrapping our arms around it, and we're saying we're going to do something, and we're going to bring it down step by step, brick by brick, mobile units, whatever it takes, white jackets from our doctors, our mental health team, everybody that needs and deserves better medical treatment and services here. And all we're trying to do is bring those services to you, to the public, to people that are in need. And I want to say without hesitation, you need us, you call us. And if you can't even come here, I understand we're even going to make it available for people to be driven over here through other resources that we're going to make available. So how about that? There's no reason why people can't receive this medical attention. So I want to say that out loud because I think it's very, very important. And one thing is really clear, I think, to me is if you are unhoused and you lack health care, those are the two main driving forces for the demise of our communities. If they don't have a roof and they don't have health care. So housing and health care inextricably and have to be brought together in one plan. So street medicine, that may sound kind of funky for some people. To me, I get it. I know what that means. It means meet the people where they are. Go where they are. Don't wait for them to come to you because they may not be able to travel to you. And that's what we need to do. So medical attention on Skid Row has and will continue to be a reality for people who need it. 40,000 unsheltered people living right now in this area. We know that. So we've got to do something. And I'm happy, as I said earlier, that this project is starting out too in my district. And I represent a large area now because it got redistricted. So I start from East Hollywood, where we've also got issues coming down through downtown LA to Skid Row and all the way to Pomona. And Pomona isn't that much different from parts of Los Angeles here. So we know that the call is there of action. And I'm happy that Department of Health Services is going to be they've already stood up similar mobile unit in East LA. I have an office out there. We got homeless out there too in unincorporated areas. So we need to be there as well. We're also going to be at Whittier Narrows at our park right next to the riverbed, where we found there's maybe 200 unhoused people on any given day, and that's been ongoing. Lincoln Park, we're going to have the mobile unit there, and at Hollenbeck Park. And I hope eventually we'll get out to more parts of Northeast LA that I now represent. So I'm working really hard with all of you. I know that our main concern here is where people don't have a place to live. And unfortunately, when they have to sleep at night out on the streets, it's hard for them to get on the phone or their cell phone or get connected to any medical provider. So that's what this is about, breaking down those barriers, making sure that even if an unhoused person is out on the street trying to fix their bike and they get scratched maybe, by putting a bike together, that infection can turn into something even more deadly. Or if they get hurt on the street and that medical attention isn't provided to them. Those are the things that we have to contend with and we have to help people address. Diabetes also, we know there's a lot of folks that don't eat well out on the street. Well, that's no surprise, but let's try to help those people get the medication that they need so that they can go treated for diabetes and help to prevent more challenges there. STDs also another area that we have to address. We absolutely have to do that. And I've been a big proponent of that. HIV, AIDS, STDs, all of that for men, women, and our young people, especially our young people. Reproductive health care should not be out of the reach for anyone that needs it, both men and women. And I also want to say that we have to make sure that we do our very best to bring more people, to draw them in to the services that are here. Hopefully, people will understand these are people that they can trust because we have some very prepared individuals with lived experience and otherwise people who know folks out here that can draw them in. And that's the biggest thing our challenge will be, is to give people that hope and trust. But one of our agenda items here is to make sure that we can prevent deaths overall. Coronary heart disease up by 78% and increased, I think, just over the pandemic enormously. So street medicine is going to help us deal with this. COVID-19, believe it or not, folks, the weather's changing and numbers are starting to go up again, right, Dr. Galley? So we need for people to come in and get their vaccinations, to get tested, and we need to help treat them for their wounds or prescribe medication, and especially for those individuals that are experiencing opiate cravings. So we need to deal with drug abuse as well. I understand that already this team has been able to deliver a baby. Wow, that's amazing. You know, can you believe these things happen, right? These are real issues that we have to contend with. Shouldn't be out on the street, though. Should be in an area where care can be given and try to get those services out to people right away. The range of services that are going to be available here are going to be provided by our expert teams, medical doctors, psychiatrists, substance use specialists, social workers to treat patients on the street. How better can you get? I mean, this is incredible. And I know that we need to make sure that we provide, as I said earlier, the needs of women. So sexual health services, contraceptives, preventive care services, including wellness visits, pelvic exams, cervical cancer screenings, breast cancer screening, preconception care services, and prenatal care. And I have to tell you, my staff told me this story. We have another facility that we're running. It's called the Hilda Solis Village, but it's a shelter for 232 unhoused people. And one of the young women there was interviewed recently, and she was able to share her story that one of the reasons she became homeless was because she couldn't afford cancer treatment. She couldn't afford to go to the doctor, so she ends up in the street. And she was so happy to have a place that would provide her wraparound services, health treatment, and all of that, but also dignity and respect. So she could have, if she had to take a shower, use a restroom, it was in the same facility. She didn't have to walk out of a little, you know, shelter and do that. She could be helped right there. Those are the things that keep me going every single day when I hear that. And when we hear about preventing people from losing their lives, that's what's essential, I think. That's the bottom line. So very briefly, I just want to say in Spanish, if I can, for those that can hear me en español. Buenos días. Mi nombre es Hilda Solís. Y gracias a todos que están aquí hoy día con nosotros en la comunidad de Skid Row en Los Ángeles. Un área con el mayor concentración de personas sin hogar en todo el condado. Después del censo, ahora represento todo Skid Row. Y por eso estoy aquí trabajando con los varios equipos para ayudar y tener una acción y un plan para ayudar a las personas que viven aquí en Skid Row. Eso incluye atención médica accesible, dar atención directamente a quienes más lo necesitan. Sabemos que la vivienda y el salud están unidos. Sin viviendas, las personas corren más riesgo de resultados negativos en salud. Medicina móvil como este equipo es un primer paso crítico para garantizar que nuestros vecinos sin refugio en Skid Row tengan una atención médica que necesitan. Cuando la preocupación de dónde van a dormir, hay poco tiempo para ir a visitar un doctor. Muchos de nuestros vecinos sin refugio nunca reciben esa atención que merecen. Por ejemplo, los pequeños heridas de algo simple pueden provocar una gran infección si no se cuiden las personas. Las enfermedades que se pueden controlar con medicamentos como diabetes no se han tratado. Y la salud reproductiva para mujeres es tan importante para ellas. La medicina móvil les va a dar ese tratamiento a nuestros vecinos sin hogar y van a tener la dignidad y respeto que merecen todos para prevenir las muertes. Me da bastante gusto estar aquí con ustedes en Skid Row, aquí en Los Ángeles, y decir también que esta medicina móvil ya va a entrar en comunidades como el este de Los Ángeles, en Whittier Narrows, en San Gabriel, en un parque donde viven mucha gente sin hogar, también en Lincoln Park y también en Hollenbeck Park. y con eso me da bastante gusto estar aquí. Hoy también quiero reconocer a alguien que también nos va a hablar ahorita. Right now, I'd like to go back to English and just say I'm very, very happy to introduce Charles Porter of Social Model Recovery Systems to come and speak to you as well. Thank you so much. Woo!
Good morning. Thank you. I'm honored to be here. In Skid Row, too many of our neighbors and community members have succumbed to death and illness because they didn't get the social support and the medical care that they needed. As advocates, we must be responsive to clearly visible needs and committed to amplifying the voices of those impacted. This approach resulted in the creation of the Skid Row Community Refresh Spot, which was envisioned by the Skid Row Community Improvement Coalition and builds on a long tradition of advocacy in Skid Row for public health equity. The Refresh Spot, which is operated by Homeless Healthcare and Social Model Recovery System, sees between 500 to 600 uses daily and is one of the locations that this mobile clinic will be hosted at. Our collaboration with DHS during COVID outreach at parks, including this one, intentionally addressed other sources of morbidity, as were mentioned earlier, including overdoses and heart disease, which are the biggest causes of morbidity for people experiencing homelessness. Providing information, health screening, food, social support, and in addition to vaccinations. The mobile clinics are yet another critical resource building upon these initiatives and collaborations. The clinics will meet people where they are, helping to increase the necessary support and resources that are needed to live healthy lives. We know from experience that this is the key to engaging the most vulnerable. We are optimistic that this accessible and essential medical care, coupled with community collaboration, will yield many positive impacts on the health and well-being of the Skid Row neighborhood. Thank you. Now, Dr. Ghali will share a few additional words. Thank you.
Thank you so much for being here, Mr. Porter. Thank you, Supervisor Solis, for your presence here and for that of your staff. I know your staff does an immense amount of work every day, day in and day out, so thank you. I'm going to start. There's a long list of thank yous also, so I do also want to extend my thanks to Deputy Mayor Good for coming here today from the Mayor's office. Thank you for being here and for your partnership on all of the work that the county and city are doing together to improve this situation and the lives of the people who call Skid Row home, so thank you for being here. There's a lot of partners. None of this work happens alone. Thank you to JWCH, to LA Christian, to People's Concern, and to Homeless Healthcare LA. Thank you to the DMH Home team. Latina, I've lost you, and to your whole team. Thank you, Latina. You've been an amazing partner to DHS, and we're so happy to continue the work with you in the Department of Mental Health. I have to thank my own team. This took a lot of work, and I am not going to name everyone by name. I will probably forget some folks, so I am sorry, but I do want to call out a few people. Dr. Galat, where are you? Oh, he is the medical director for the mobile clinics and poured his heart and soul into making this work, so thank you, Dr. Galat. Dr. Beth Farouz. Thank you, Heidi. She is the medical director for Housing for Health and was instrumental in envisioning the mobile clinic, in getting the COVID vaccination work up and running, started and launched the quarantine and isolation sites during COVID, and just did so much work in making all of this happen. To Sarah Mayen. Sarah is our Director of Housing for Health, and she and her team do a fantastic job bringing services to the people who are experiencing homelessness. Dr. Hong, to Clemens Hong. He's the Director of Community Programs and oversees both Housing for Health as well as our Office of Diversion and Reentry and several other programs, including all of our harm reduction work. And Dr. Hong's been an incredible partner and leader for all of our community programs that we're working to build up more and more within DHS. Thank you to the rest of the Housing for Health team. I'm just going to ask that you wave. There's a slew of people who work on the mobile clinics, who have done an immense amount of work to get this up and running. It is big and it is beautiful, and if you haven't had a chance to go inside, I hope that you'll take an opportunity to have a tour. But when you look at it, I want you to think, for every single thing that you see, there were like 10 people working for a year plus to get it together and make it happen. The pharmacy, the lab, the lights, everything, the rooms, the plumbing, all of it. It took so much work, and that work wouldn't have happened without the support of the pharmacy staff. Thank you, Jill. Thank you to your team for being here. There are medicines that are available on this van so that people don't just have to get a prescription and then go find a retail pharmacy, which is incredibly inconvenient. Thank you to our lab staff. Do we have anyone representing the lab here today? I'm not sure if we do, but I can only tell you how hard lab work is. It is one of the most highly regulated areas of medicine, and it is immensely difficult, but this mobile clinic can provide blood draws and get samples sent off to the lab. So again, clients don't have to come back in for a separate visit. And then thank you to the team from Rancho. Ben and Walter are here today. And for regulatory reasons, we had to link this mobile clinic to a facility. I'll spare you all the details of why that's true, but we had to do it, and Rancho raised their hand and said, we will do it. We have a few other things going on at Rancho, but they stepped up. They said, we'll partner with you. We'll help you through all of those steps of the way. There are so many other people, and I'm sorry that I haven't listed everyone by name, but I just want to give my heartfelt thanks to the entire Housing for Health team, and as well as all those, the rest within DHS. You do amazing work every day to bring services to those who need it most. And this is an example of a model that is, I think, really a new way in which care needs to be envisioned. So much the healthcare system and the way it operates is incredibly not client-centered and patient-centered. It asks to start with everything is immensely administratively complicated. We bog people down in paperwork and our staff down in paperwork and regulations, and then we ask patients to come to us. We said, come to me for this, come to me for this, now go here for this. And we're directing patients where to go, and it just doesn't work. It works for some people, but the vast majority of people it doesn't work. And there's a lot of different ways in which we need to innovate the way in which care is delivered, but this represents a huge step forward. And it was launched as part of our work during the COVID pandemic when we knew that the risk of people experiencing homelessness to COVID was huge. Housing for Health also raised their hand and said, we'll get out there, we'll work on getting testing, we'll work on getting vaccinations, we'll do street outreach and make sure people know how to isolate, we'll build isolation and quarantine sites so that they're not trying to isolate on the street or in a shelter, which we know is not going to work very well. And they took those challenges and made it work. Made it work very fast in the middle of a pandemic, in the middle of an emergency, solved immense number of logistical challenges in doing so, and I'm just so grateful for the work. And I hope that we can pattern this, that we can build it, that we can replicate it, and we can continue to innovate from here to be able to build services for people in a way that they want to and need to use them so that we can ultimately improve their health. The units, there's going to be 4 of them right now, though we hope to scale from there. They will park at certain sites, and then there will be shuttle van services that help to bring the people to the vans. So, and then those vans will also come out in between visits from the broader clinic to do ongoing follow-up care with clients, and they'll have a regular schedule that they will follow. This van can do, as I mentioned, a lot of things: vaccines, medicine, labs, physical exams. So we really hope that largely it can be a one-stop shop for people. Won't be able to solve every last healthcare thing that someone might need. At some point, yes, someone may need a specialist, or they may need to go to a hospital, or they may need advanced imaging. But the vast majority of people don't need that, and they can get what they need here and address all of those conditions that I think Supervisor Solis so aptly mentioned. We're going to keep this going from here. So I hope this is the first of many ribbon cuttings. I hope that you join us for many more to come. And again, my thanks for you to be here. Thanks for your support of health services and support of the county and what the county is doing and the vision that Supervisor Solis has laid out to ending homelessness in LA, bringing the Skid Row action plan to reality, and getting this problem solved.